Which classification categorize risk of breast cancer due to pre-existing lesion in breast? DuPont and Page classification. In DuPont and Page classification, which categories has no risk for breast cancer? Non-proliferative lesion, cysts, mild hyperplasia of usual type, columnar cell change. In DuPont and Page classification, which categories has 1.3-1.9 times risk for breast cancer? 1. Proliferative lesion without atypia. 2. Sclerosing adenosis. 3. Florid ductal hyperplasia. 4. Radical scar. 5. Intraductal papilloma. 6. Fibroadenoma. In DuPont and Page classification, which categories has 4 to 5 times risk for breast cancer? Atypical hyperplasia, atypical ductal hyperplasia, atypical lobular hyperplasia. In DuPont and Page classification, which categories has 9 times risk for breast cancer? Carcinoma in situ. Breast conditions associated with smokers. Breast cancer. Duct ectasia, Maunder disease. How many times low-dose OCP increase risk of breast cancer? They don't. How many cases of breast cancer are sporadic and familial? 10% familial, 90% sporadic. MC gene mutated in breast cancer. P53. MC gene mutated in familial breast cancer. BRCA1. MC gene mutated in ER-PR-positive breast cancer. PIK3CA. MC gene mutated in TNBC breast cancer. P53. HBOC syndrome is associated with gene. Hereditary breast and ovarian cancer. BRCA genes 1 greater than 2. Which cancers are associated with BRCA2 greater than 1? Pancreatic, prostate, male breast. Which cancers are associated with BRCA2 equals 1? Colorectal, peritoneal. Indication for BRCA testing. 1. In all patients with BRCA gene mutation in blood relation. 2. All patients with personal history of ovarian, fallopian tube, primary peritoneal cancer. 3. Patient whose blood relative diagnosed with BC at less than 45 years. 4. Patient who have LBC at less than 50 years. 5. Patient with triple negative BC less than 60 years. 6. Male breast cancer. Risk reduction strategies for patients with BRCA mutation. 1. Bilateral mastectomy. 2. Bilateral salpingo-oophorectomy. 3. Tamoxifen. By how many percentage the risk of breast cancer is reduced by prophylactic bilateral mastectomy? 95%. Skin and nipple is spared. By how many percentage the risk of breast cancer is reduced by prophylactic bilateral salpingo-oophorectomy? Breast cancer 50%. Ovarian cancer 90%. By how many percentage the risk of breast cancer is reduced by tamoxifen? 47%. What's the brown stain that's used in immunohistochemistry for breast cancer? DAB3, 3-diaminobenzidine. Which quadrant of breast has max chances for cancer and which has least? Upper outer quadrant max, lower inner quadrant least. TNM classification for BC, T. T equals tumor size. TIS cancer in situ DCIS or Paget's. T1 equal or less than 2 cm. T2 5 cm. T3 greater than 5 cm. T4A, involved chest wall. T4B, involved skin. T4C T4A plus T4B. T4D inflammatory cancer. TNM classification for BC, N. N0 no regional node metastasis. N1 palpable mobile ipsilateral axillary node. N2A, palpable fixed ipsilateral axillary node. N2B internal mammary node involved but no axillary lane. N3A ipsilateral infraclavicular lane. N3B internal mammary plus axillary lane. N3C ipsilateral supraclavicular. TNM classification for BC, M. M0 no distant metastasis. M1 distant metastasis. Involvement of skin in breast cancer means ulceration, direct infiltration, hued orange. Involvement of chest wall in breast cancer means serratus anterior, ribs, intercostal muscles, not pectoralis muscles. Most common sites for metastasis of BC: bones, lumbar vertebrae due to Battison plexus of valvulus veins, osteolytic greater than osteoblastic. Which investigation is IOC for staging in BC? PET court positron emission tomography, computed tomography. Dye used in PET court for BC in its half-life: 18 FDG, fluorodeoxyglucose. T-half 110 minutes. PET court is not sensitive for brain, so in brain metastasis of BC, IOC is Emery. In prostate metastasis of BC, IOC is PSMA PET, prostate-specific membrane antigen PET.